Okay, today we're gonna continue talking about the skull base, and we're gonna continue with the ethmoid bone. As you can see, and you remember we spoke when we talk about the frontal bone. We located the ethmoid bone inferior, okay, to the frontal bone. So we can say that ethmoid bone is a central and symmetrical bone. It's located inferior to the orbitonasal portion of the frontal bone, and in the anterior and middle portion of the skull base, located in front of the sphenoid bone and complete all the ethmoid notch here. Remember, ethmoid notch, and as you can see in this picture, you see it's cover all this notch. So the ethmoid consists in 4 parts: one vertical, and the one vertical. The other one is horizontal one, who divide this vertical part in 2 portions. We're gonna talk about that later, and 2 lateral masses, make in blue, and 2 lateral masses here, or labyrinth. They are located lateral end of the ethmoid of this horizontal plate. Okay, the lateral end of this horizontal plate. And now we're going to talk about all these parts together. So the vertical plate is divided by the horizontal plate, the lamina cribosa here, the horizontal plate, or horizontal lamina, into portions. One superior, Crista Galli, and the one inferior is the perpendicular plate, or lamina perpendicularis. So here the Crista Galli is a triangular process. You can see here it's a triangular process consisting 2 surfaces, both of them convex here, lateral and convex. A base, look, the base here, and the vertex. One anterior border or edge and one posterior border. So the vertex is smooth and rounded. Here the falx cerebri, yes, this is the falx cerebri here. Here the falx cerebri is attached, and you can see here the posterior border. You see each oblique from superior top, so from superior to inferior posteriorly, and it's going like disappear. You see here again, you can identify here the posterior border. You see, because it's going from up to down in this direction, from up to down, going posteriorly and vanish in the lamina cribosa. So the anterior border also is articulate with the frontal bone and complete the foramen caseum. Oh, you can see it well. Something important is here in this anterior border. In anterior border, you can see usually the anterior border gonna have 2 extension laterally, and they are calling crest, or they are calling wings of the Crista Galli, okay, or Crista Galli crest, because they are, you can see here, and this is we are watching here the Crista Galli anteriorly, and you're gonna see these 2 wings of crest, of Crista Galli crest here, okay? They're going like this. So now the perpendicular plate, or lamina perpendicularis, as we spoke before, remember, we're gonna find it here inferiorly to the lamina cribosa. It's gonna have 2 surfaces, and both of these surfaces they are excavated by vasculonervous groove by the elements, okay, especially near to the superior border. I'm gonna have one superior border, anterior inferior border, another one posterior border here, or posterior superior border, and posterior inferior border. Okay, the anterior border is articulated superiorly with the nasal spine of the frontal bone, this one here, and the anterior inferior border joined with the cartilage of the nasal septum. Okay, you can find here. The posterior border articulates with the sphenoid crest and the body of the ethmoid bone. Okay, yes, you're gonna find it here. The sphenoid crest here. You see here, the sphenoid crest. And the posterior inferior border, is gonna join with the anterior edge of the vomer. It's very important to remember this perpendicular plate is the septum, is the most important part of the septum, the nasal cavity. You can see it here. You can see here this perpendicular plate here. Well, this is perpendicular plate. You can see inferiorly perpendicular plate, and again you can see here the perpendicular plate. Okay, anterior border, anterior inferior border. So now we have this element here, the horizontal plate of Crista Galli. It's called Crista Galli because present a big amount, numerous foraminas through it. You can see it here, all this foramina. You can see it, all this. It's a quadrilateral plate. So as you can see, all these foramina, they are channels that run for these channels run from the anterior to posterior the olfactory nerve branches. This you can see it here. So this is the horizontal plate or lamina cribosa, and you see all these little branches, going from the nasal cavity to the cranial cavity, to the neurocranium, directly to the olfactory bulb. Okay, so usually we have 25, 30, 35 of these foramina. Okay, they are arranged in 3 rows. Okay, you can see only one is one, but usually they are arranged in 2 rows, one outside another one here, median, and in the middle line here. Okay, 3 rows. So on the side of the Crista Galli, we're gonna have a narrow slit. It's called ethmoidal slit here, where we're gonna find some extension of the dura mater. Laterally to this ethmoidal slit, we're gonna find an oval foramina. It's called the anterior ethmoidal foramina. This one I pointed here. Through this anterior foramina, okay, you can find here. Through this anterior foramina, we're gonna find the anterior ethmoidal artery, okay, going into the cranial cavity. And later also we're gonna find the posterior one, the posterior foramen, the posterior ethmoidal foramen. Which element go there? Yes, the posterior ethmoidal artery and the nerve also. Both of these arteria, they are a branch of the ophthalmic artery. So at the end we have the ethmoidal labyrinth. As I mentioned before, we're gonna find laterally here in the lateral edge of the horizontal plate of lamina cribosa. So in the labyrinth we're gonna find 6 walls: one anterior wall, posterior wall, superior, inferior, lateral and medial wall. The anterior wall is cut in bevel weight, and it's articulated with the superior portion of the medial surface of the lacrimal bone. Okay, and also it's going to articulate with the medial surface of the frontal or ascending process of the maxillary bone. So you can see it here. This is the anterior surface. Anterior surface here, anterior surface. The posterior surface is quadrilateral shape and is joined to the anterior surface of the ethmoid bone of the body, and the anterior surface of the body of the ethmoid bone. And also this is superiorly, and inferiorly it's gonna articulate also with the orbital process of the palatine bone. So you can see here, this is posterior surface. Oh, good. This is, you can see it here much better. This is anterior, okay? This is, you can see here, anterior. You can see the posterior wall. This is the anterior surface of the ethmoidal labyrinth, posterior surface of the ethmoidal labyrinth. Anterior, remember, lacrimal maxillary, posterior, sphenoid, and palatine bone. So you see here, this is the anterior surface of the sphenoid bone, and this part here is gonna be the ethmoid. The posterior surface of the ethmoid labyrinth is gonna articulate there. Over and over again. I'm gonna repeat. This is like a transformer. The skull base is like a huge transformer. So the superior surface is almost at the same level of the superior surface of the lamina cribosa, and it's going to articulate with the ethmoidal labyrinth of the frontal bone. So remember, frontal bone, you can see this is, we're watching an inferior view of the orbitonasal surface, and you see here this is ethmoid labyrinth of the frontal bone, or we can call it just the ethmoidal surface of the frontal bone, and it's going like a transformer. And you see here, you can see superior surface, again superior surface. Yes, superior surface, you see it here. So this surface usually presents 2 channels, one anterior and another one is posterior. These 2 channels, it's marked like here. These 2 channels, when they join with the frontal bone, these 2 channels become dots. These channels are the ethmoidal anterior and ethmoidal posterior channels. So the inferior surface now, we find it here. You can see here the inferior surface is oriented obviously inferior and laterally, and present from medial to laterally, the inferior border of the middle turbinate, the middle meatus, and is articulated with the most superior portion of the nasal surface of the maxillary bone. And here we're gonna find the lateral wall. You can see here. The lateral wall is flat, is smooth, and almost is vertical. Constitute a very flat and thin sheets, which is laterally a limit from the ethmoid labyrinth, and also is the a part of the wall of the orbit. This is the papyracea lamina papyracea. Okay, you can see it here, lateral wall or lamina papyracea. Perpendicularis papyracea, it's not the same. Okay, we cannot confuse with that. And in the end, I'm gonna have the more complex one, is the medial surface. The medial surface, yeah, it's from the most of the external wall of the nostril of the nasal cavity. You can see here it's gonna have this process, this convex medially. You see, medially there are convex. This process, they are called turbinate or concha. We're gonna have two, one superior, one inferior, one middle here. Between the wall of the labyrinth and the turbinate, we're gonna have the meatus, this wall, this space, the meatus superior and meatus medium. We have three turbinates, but the inferior turbinate, it's an isolated bone. It's a different bone. It's not belong to the ethmoid bone. So sometimes we can have one or two supplementary or overlying ethmoidal nasal turbinate. Okay, they are more superior to the superior nasal turbinate or here or ethmoidal turbinate. There are the supreme and the supreme turbinate or supreme ethmoidal turbinate. It's gonna be here. And the other one is the sugar cane nasal turbinate. And you can see here, you can see this bone here. This from the anterior surface of the middle nasal meatus, we can see the emerging a thin bone, a thin lamina bone is the unciform process. This is direct inferior and posteriorly. It's crossing the posterior superior maxillary hiatus, because we're gonna find the hiatus of the maxillary sinus in this area. So this unciform process posteriorly is gonna finish like in two lamellae. One inferior, which is articulated with the ethmoidal process of the inferior nasal turbinate, and the other one is more posterior and very small, and it's gonna be like a direct extend to the posterior edge of this maxillary hiatus. This is like it's gonna finish in a free end. So posterior to the unciform process, the lateral wall of the middle nasal meatus is raised by the ethmoidal cells, which form an elongate protrusion in oblique direction, is called ethmoidal bulla. You see the unciform process, part of the yes, you see the unciform process here. Okay, So with that, we finish with Ethmoid. Ethmoid bone is it's an easy bone. Okay, just need to read and reread again and again.